Cluster headache is the topic for this video, and cluster headache is one of the many types of headaches, but it's commonly tested on the licensing exams, and it most commonly occurs in men. It can occur at a very range of ages, but 20 to 40 is most common, and the symptoms, obviously from the name of the topic, it's obviously a headache, but it's in particular unilateral, one-sided, and it commonly occurs at night, so it awakens the person from sleep. And there's certain keywords that they tend to always use when describing this headache, and one of them is excruciating. So these are some of the keywords. If you really sort of to get into the actual symptomatology or symptoms, some of the key symptoms that they commonly described are runny nose, rhinorrhea, tearing, lacrimation, and ptosis, which is a drooping of the eyelid. And this headache can be pretty distressing and can occur again and again, and it can also be episodic in nature as well. The diagnosis, really, there's no diagnostic test. It's really just based on symptoms and history. Treatment, the most common treatment that they test on the licensing exams is you give the person 100% oxygen. And that is actually the treatment for cluster headaches. There are two medications that are used as well. The first one is called ergotamine, and the second type of medication is known as a triptan. That's the class, and one of the most common is sumatriptan. So that's the treatment. So quickly recapping, cluster headache, you've got a unilateral presentation. In terms of location, they describe it periorbital, around the eye, possibly even temporal region. In men, 20 to 40 years of age. Symptoms include drooping of the eyelid. You've got lacrimation, runny nose, rhinorrhea. And you can also have these attacks in clusters, and hence the name. But what you really mean by that is sort of like this episodic nature, where you have it for 1 to 3 months, and then it goes away, but then it comes back. And the treatment includes oxygen, ergotamine, and the triptan class of headache medicines. So let's look at some clinical vignettes. 50-year-old man presents with history of recurrent attacks of headache which manifest with peculiar rhythmic pattern. Each attack begins on awakening approximately at the same time. He reports severe unilateral pain located in the right eye and temple, accompanied by runny nose, lacrimation, and sweating on the same side. The attack spontaneously resolves after 2 hours. Neither his siblings nor his parents had similar headaches. Temperature is 96, blood pressure is 130/80, pulse is 80. Pupils are equal and normally reactive to light. Fundoscopic exam is unremarkable. Which of the following is most likely diagnosis? There's a lot of clues in here. You've got the fact that it awakens him. It's around the periorbital and temporal region. You've got the rhinorrhea, the lacrimation, so all points to cluster headache. Next one. 35-year-old man comes to the physician because of daily severe periorbital right-sided headaches over the past 6 weeks. Pain often awakens him from sleep and is so excruciating that he wants to bang his head against the wall. He reports nasal stuffiness and nausea He has had similar episodes on 2 previous occasions. Physical exam shows right-sided ptosis, lacrimation, and reddening of the right eye. Lab studies, hemoglobin 16, hematocrit 49, leukocyte count 6,000, and ESR 5, with likely diagnosis. Again, a lot of clues in there. They throw in this ESR because that's elevated in temporal arteritis. So they talk about that because if in temporal arteritis the ESR is elevated. So just in case you're wondering why they put that in there. But this case is clearly describing a cluster headache. And one last one. A 43-year-old man comes to the emergency department at 3 a.m. because of constant severe headache for 1 hour. Pain is localized behind the left eye. He also had a watery discharge from the left nostril. He has had similar episodes nightly over the past week. He has had a history of similar symptoms over a 3-week period to 2 years ago. His left pupil is smaller than his right, and there is ptosis on the left. Watery discharge is visible on the left in the left nares. Most likely diagnosis is, again, a lot of symptomatology pointing to cluster headache.